The American Health Lawyers Association, leading health law to excellence through education, information, and dialogue. Coming together is the beginning. Working together is progress. Learning and sharing together is success. With so many ways to connect to colleagues and friends these days, why does membership in the American Health Lawyers Association stand out from the rest? AHLA members can answer that question best.
The American Health Lawyers Association has been critical to my career. In fact, I can't imagine practicing healthcare law without the participation in American Health Lawyers.
Attending the various AHLA programs has been great because it's a chance to meet people across the country in different sectors that I wouldn't normally otherwise meet in my workplace.
I think one of the benefits for government attorneys to be involved in AHLA is the speaking opportunities. People in private practice want to hear what the government has to say. They want to hear our perspective, just as we should want to hear their perspective.
I belong to the American Health Lawyers Association because I think it's very important to interact with other attorneys outside of the DC office of Jones Day where I am to find out how other people practice, the types of cases that they do, and just get experience.
I get emails notifying me of things first off, so I can go to my management team, I'm in-house counsel, and inform them. It helps me practice, it helps me to be more efficient, it helps me get my job done.
The opportunity to work with the staff, other great lawyers around the country, some of the best lawyers in the country, both in the private bar, in-house, and with the government. You get the opportunity to work with all those people. Collegiality is, I think, always has been one of the hallmarks of our organization.
For more than 40 years, AHLA has been the premier national association dedicated to educating health and life science lawyers, as well as other professionals who advise the healthcare industry.
We have been working with AHLA over the course of the last several years and have found this relationship to be extremely beneficial for our company. We provide healthcare consulting work and we work very collaboratively with healthcare lawyers, so it's given us an opportunity to meet and be able to create relationships, but also the educational offerings that they have are outstanding.
Between the quality and the depth of the education, the networking opportunities, and the opportunities to really interact with the types of people who attend and who speak at the AHLA conferences. It is a relationship that we value tremendously.
Through our in-person programs, practice groups, discussion lists, extensive offering of publications, public interest activities, and alternative dispute resolution service, AHLA offers multiple and varied opportunities for our members to learn, to share, to excel, to grow, to connect, and to succeed.
And what I found with American Health Lawyers is there's a great opportunity to give, and there is really, I think, a concern that folks who want to put the time in on education, teaching, and speaking are provided that opportunity to do so.
In order to get the most out of our organization, you should join a practice group, you should write for one of our publications, you should propose to speak at one of our programs. The more you invest, the more you're going to get out of this association.
You can be part of this dynamic community, share its rich educational resources, and connect in a meaningful and lasting way with colleagues.
Being a part of AHLA gives me a reality check.
I think every health lawyer should belong to this association.
And you get feedback and advice very generously and shared resources. It just makes you a better lawyer.
The opportunities that American Health Lawyers provides are, I think, the most valuable in the industry.
The American Health Lawyers Association, where you can belong, contribute, and connect.